Good morning, everybody. It is 9:30 in the morning. I'm in Boonville. Central Missouri is cold and it's rainy and it's windy. It's been windy. It was 86 yesterday. This morning it's 46, I think. I decided to use my phone for this class because that little three-letter company keeps kicking me off the internet this morning. So I thought, well, rather than be right in the middle of a class and having technical difficulties, I would use my phone. So it probably looks a little different. Hopefully you can hear me okay. So we started talking about fasting on Wednesday. All the health benefits of fasting, and I've still got more to talk about with that. But I thought that since I mentioned Jason Fung on Wednesday, and I recommend his Facebook group for people trying to lose weight, the fasting method, that I would actually just talk to you about an article that he wrote on reversing type 2 diabetes. And he is a kidney specialist in Canada, has dealt with a lot of diabetic patients, and basically has proven that what I was taught in medical school is not true. So we're going to talk about fasting as a method for reversing type 2 diabetes and insulin resistance, but at the same time, there's a weight loss symptom or side effect. So, like I said Wednesday, fasting isn't necessarily a weight loss thing. I've used it for weight loss. I've reversed my insulin resistance. I've done it. I had a hemoglobin A1C level of 5.8, which is insulin resistance, metabolic syndrome. I was 205 pounds, hypertensive, hypercholesterolemic, blah, blah, blah. And I reversed it in 6 weeks. My doctor was amazed. Took me off all my meds. And so the whole goal of fasting methods and reversing chronic illness is to get you off of pharmaceutical meds. Morning, Wendy. So I was taught, like most doctors, dietitians, diabetes specialists, that type 2 diabetes is a chronic and progressive disease. You can't cure it. Now, that might be true for type 1. That's a genetic thing. So the American Diabetes Association kind of claim this on their website, that type 2 diabetes is chronic, debilitating, it's irreversible. You have to take medications to control it. And so once you get the diagnosis, it's considered a life sentence. But that's actually not true. And Jason Young and several other doctors, I mention him because I've read his books and I've looked at his website, and I follow his Facebook fasting method page. So type 2 diabetes is almost always reversible. Okay, and it's fairly easy to prove, and he does that in this article that I'm referencing. You can find it on Medium, and I will probably, if I can figure out how to do it, I will put it up so you can read it after I get done with this little class. Okay, so we talked about diabetes and insulin resistance in May when we were going through the cholesterol myths, etc. And we talked about diabetes in there. And about 100 million people, he's saying 50% of American adults diagnosed with prediabetes or diabetes, insulin problems, resistance, diabetes, etc., about 100 million. So that would be a third of the country. He's saying 50% of adults. I don't know how many of the 335 million people we have are not considered adults. So he's in the right ballpark. So recognizing the truth that you can reverse diabetes is the first crucial step in reversing it and in reversing insulin resistance. And he says that actually most people instinctively know and recognize that that's true. So suppose you have somebody who has been diagnosed with type 2 diabetes, works hard to lose 50 pounds, he winds up like me, and I didn't lose 50, I lost 41. He winds up off all of his medications. Hey Donna, hey John, Lori, goodness, you guys are joining. So let's say you, like I did, I was on 2 antihypertensives, I was on Lipitor, that didn't last long. And so really, you wind up off all your meds. So I saw a family physician friend of mine in Midwest City, and when I had lost 42 pounds, she basically said, you don't need your meds. And I go, well, I know that, because if I take my blood pressure meds, I'm actually kind of dizzy. That's still kind of true. I have to play with my meds. Hypertension, I didn't get rid of. I've had it since I was 30. Okay, so what would you say to a person that lost 50 pounds, went off all of his medications, blood sugars are normal? What would you say? You'd say, oh, that's great. Keep doing that. You're taking care of yourself. What you wouldn't say, and this is a direct quote from Dr. Fung, is something like, you're such a dirty, filthy liar. My doctor says this is a chronic and progressive disease, so you must be lying. Well, there are thousands and thousands and thousands of people that have followed this little way of life that have proven that the type 2 diabetes and insulin resistance is not a chronic and debilitating disease. So it seems fairly obvious that diabetes is reversed because the friend lost 50 pounds. My insulin resistance reversed, so my hemoglobin A1C at 5.8 made me, with that diagnosis, insulin resistance and metabolic syndrome. After I got done, and it literally took 31 days to lose 42 pounds, and then 3 weeks to reset my leptin level in my fat cells, so that my brain realized, oh, this guy weighs 163 pounds instead of 205. We're going to change his metabolism so he continues to do that. So my hemoglobin A1C fell from 5.8 to 5.2. I've gained a little bit of that weight back, 175. I'm still at 5.4 last time I checked. So the point is, type 2 diabetes and insulin resistance and metabolic syndrome is reversible. So we've pretty much known this all along. Only diet and lifestyle changes will reverse it. It's not medications. So the most important thing is to lose weight. So if you're heavy, you lose weight, and fasting is part of that. We'll get to that. Diabetic medications do not cure diabetes. They lower blood sugar. So insulin is fairly notorious for weight gain as a side effect. So patients on insulin intuitively seem to sense that they're going down the wrong path. They're headed in the wrong direction. You're not curing anything. You're treating blood sugar levels. So Dr. Fung's patients would say to him, Doctor, you've always said that weight loss is the key to reversing diabetes, yet you prescribed me a drug that made me gain 25 pounds. How is that good? Before he went into this type of research and looked at it, he never had a good answer because there was no answer that existed that made sense. The truth was, and is that insulin is not good for type 2 diabetes. All it does is reduce blood sugar levels. So the key is weight loss, whereupon the diabetes actually goes away, or at least gets significantly better. So logically, insulin does not help reverse diabetes, it actually worsens it. Other medications, glucophage, metformin, glyburide, all the other medication classes for diabetes are kind of weight neutral. Insulin causes weight gain. So while they won't make the weight loss or the diabetes worse, they won't make things better. You're not treating diabetes. So see, I try to get off my meds. One of the side effects of my meds is a dry cough. But I got to take them. Okay, since weight loss is the key to reversing type 2 diabetes, medications will not make things better. So medications make blood sugar, which is the symptom, better, but not the diabetes, which is the actual disease. So we've been pretending that blood sugar levels, glucose levels, is the disease. That's not the disease. Okay, so we can pretend if blood sugar levels are better, the disease is better, but that's not true. So that's the reason most doctors think type 2 diabetes is a chronic and progressive disease. We've been using the wrong treatment, and we've been using the wrong treatment for years and years. We've been prescribing drugs for a dietary disease and expecting it to work, and it doesn't. So how do you do it? So the next part of this article he titles The Sugar Bowl. And when I first read this 2 years ago, I started sending it to people that I was health coaching to help reverse type 2 diabetes. And I've done it with the HCG diet, which the FDA says doesn't work. It does work. That's how I did it. That's how I reversed my insulin resistance. And then when I decided I'd gotten a little bit heavier 2 years ago, I needed to reverse that again. I used intermittent fasting. So the essential feature of type 2 diabetes and prediabetes is that your body is completely filled with sugar. It's not just that there's too much sugar in your blood. That's only part of the problem. So there's too much sugar in your entire body. So imagine that your body's a sugar bowl. So a bowl of sugar. When we're young, our sugar bowl is empty. And then over decades, and we talked, 4 weeks ago, about formula basically being a milkshake for babies and creating a sugar addiction. So when we eat enough wrong things, too many sugary things, I guess, sugary cereals, desserts, white bread, over time, the sugar bowl gradually fills up with sugar until it's completely full. And so the next time you eat, sugar comes into the body, the sugar bowl is full, your cells, so then it spills into your blood. So insulin is the hormone that's produced in your pancreas that helps you put sugar into your cells. So it's designed to reduce blood sugar levels by putting it into your cells. So when it's no longer able to do that, the glucose piles up outside cells in blood. So insulin, that's called insulin resistance. That's the first step towards the type 2 diabetes. Metabolic syndrome is the other name for that. Although you can have insulin resistance without having that diagnosis. If you're headed in that direction and you have insulin resistance, you will eventually get metabolic syndrome, and if you don't reverse that, you will eventually get type 2 diabetes. And if you don't reverse that, you will eventually wind up on meds to reduce your blood sugar, which is just a symptom. Okay, so why does blood sugar levels go up? Well, the cells are already overfilled; they're full. Okay, so it's like trying to blow air, Dr. Fung says, into an overinflated balloon. It just takes more force. So the cell is resisting the glucose because it's completely full. So insulin resistance is really an overflow phenomenon of the sugar bowl being too full. So it'd be like filling your gas tank with gas and that clicky thing goes off and you decide to top it off. Everybody does that. But then you're completely full and then you take it out and start spewing gasoline all over your car. Why would you do that? So if your cells are full of sugar, putting more sugar in your body is just hanging around in your bloodstream. So his other analogy is like packing a suitcase. So you're putting clothes into a suitcase. So pretty easy when you start. After a certain point, you cannot get any more clothes in the suitcase and actually get the suitcase closed. So the suitcase is now resistant to close. So it's way harder to put in the last two pieces of clothing than it is the first 5, 6, 7, 8, 10, 12, whatever you put in that. So it's the same overflow phenomenon. The cell is filled to bursting with glucose, so trying to force more glucose in is difficult, and it takes more insulin. And eventually the insulin doesn't work. And then you have to take more insulin. And then you're on shots of insulin. And your insulin dose keeps going up and keeps going up, and it's a never-ending cycle. So when the insulin levels are unable to keep up with the increasing resistance, blood sugars rise, you get diagnosed with type 2 diabetes, you get started on a pill. Metformin doesn't get rid of the blood sugar. It typically takes the sugar from the blood and puts it back into the liver. The liver doesn't want it either because it's full, so it ships it out to other organs, the kidneys, the nerves, the eyes, the heart, and most of this extra sugar just gets turned into fat to store it. So the problem, of course, has still not been solved. The sugar bowl is still overflowing. All you've done is move sugar from the blood, where you can see it, into the body where you can't see it, and then it's in stored fat. You can see that. So it's putting a Band-Aid over a bullet hole, he calls it. So the very next time you eat, the very same thing happens. Sugar comes in, it spills into the blood. You take medication to cram sugar out of back into your body. That works for a while. Eventually, the body fills up with sugar as well. So now that same dose of medication can't force any more sugar into a body that is completely filled with sugar. So you go see a doctor. Instead of getting rid of the toxic sugar load, the doses of medications go up. If the luggage doesn't close, the solution is to empty out the luggage or take some clothes out, not try to use more force to close the luggage. So the higher dose of medication may help for a while, but only for a small time. Blood sugars go down as you force your body to gag down even more sugar, and eventually that dose fails. Then you get a second medication, then you get a third medication, and then eventually you're on insulin injections. So anybody that you know that's had type 2 diabetes, that's the story, right? So over a period of years, you went from normal sugar to prediabetes, insulin resistance, to diabetes, to taking one medication, then two, then three, and then finally insulin shots, and then even more insulin doses. Insulin's gotten ridiculously expensive. I mean, just ridiculously expensive. So if you're taking more and more medications to keep your blood sugar under a certain level, your diabetes is getting worse. You're taking medications for a disease that's getting worse on the medications. So even if your blood sugar looks normal, your diabetes is getting worse. And that happens to most people that are being treated for type 2 diabetes. The body's overflowed with sugar. Okay, so the medications only hide the sugar, keep it out of your blood. So the diabetes looks better on a blood test, since you can only see the blood sugars and maybe your hemoglobin A1C level. And then everybody thinks that, ooh, everything's great, I've done a great job, the patient's better, the doctor feels better. All the while, the patient's actually getting sicker. So ever increasing doses of medication, yet those people still suffer from heart attacks, congestive heart failure, kidney failure, strokes, amputations, and blindness. And the medical teaching is, oh well, that's what happens with diabetes. It's a chronic and progressive disease. Okay, so Dr. Fun always comes up with interesting analogies. So he says, imagine that you hide your kitchen garbage under the rug instead of throwing it outside in the trash. You can't see it, so you can pretend that your house is clean, but when there's no more room under the rug, you start throwing the garbage into the bedroom and then the bathroom, anywhere you don't have to see it, and eventually it begins to smell. You need to throw out the garbage, not hide it. So if we understand that too much sugar in the blood is toxic, why can't we understand that too much sugar in the body is toxic as well? So over time, 10, 20 years of type 2 diabetes, every single part of your body starts to rot. And this is why type 2 diabetes is really unlike a lot of other diseases, because it affects every part of your body. Every organ suffers the long-term effects of excess sugar. Your eyes rot, you go blind, your kidneys rot, you need dialysis, your heart rots, you get heart attacks, you get heart failure, your brain rots, you get Alzheimer's disease, your liver rots, you get fatty liver disease, your legs rot, you get diabetic foot ulcers, your nerves rot, you get diabetic neuropathy. Virtually no part of your body is spared from too much sugar and type 2 diabetes. So medications, insulins do not slow down the progression of organ damage because they don't eliminate the toxic sugar from the body. Okay? So there's been, he quotes, 7 multinational, multi-center randomized controlled trials of tight blood glucose control with medications failed to demonstrate reductions in heart disease, which is the major killer of diabetes patients. So we have pretended that managing blood sugar and making it lower makes people healthy, or healthier. You cannot use drugs to cure a dietary disease. So once you understand that, then the solution becomes pretty obvious. If you have too much sugar in your body, you have to get rid of it. So you can't just use medications to hide it so you can't see it. And there's only 2 ways to get rid of sugar in the body. 1 is to not put sugar in your body. And 2 is to burn off the sugar that's in your body. And that will reverse type 2 diabetes. This does not involve drugs. It doesn't involve surgery. It doesn't really cost anything. It's natural, completely free. You just have to do it. So step 1, don't put sugar in. The first step, eliminate all sugar and refined starches from your diet. There's no nutritional value to sugar and carbohydrates. We talked about that a month ago, and I said, what's the least amount of carbohydrates you can eat and sustain your life? The answer is 0. You can live on ketones. Your brain will run on ketones, and whatever sugar, glucose that your body needs can be made in your body. You do not need to eat it. Starches are just long chains of sugar, so flour, white rice, quickly broken down to glucose, absorbed into the blood, raises blood sugar. So eating white bread increases blood sugar quickly. So it seems self-evident that we should avoid foods that raise blood sugar because they will eventually be absorbed into the body. So the optimum is to eat little or no refined carbohydrates. And most importantly, stick to eating whole, natural, unprocessed foods. Step 2, burn it off. Burn the sugar off. And fasting is the simplest and safest method to force your body to burn sugar. So glucose in the blood is the most accessible source of energy for your body. Fasting is merely the flip side of eating. If you're not eating, you're fasting. When you eat, your body stores food energy. When you fast, your body burns food energy. So if you just simply lengthen out the periods of fasting, you're going to burn off stored sugar. So type 2 diabetes is excess glucose in the body. Burning it off will reverse that disease. So fasting's been practiced for 2,000 or so years. You've heard about Mahatma Gandhi doing it, lots of religious people. It's the oldest dietary therapy known in the history of mankind. So literally millions of humans have fasted, sometimes because they had to, they couldn't find any food. So if you're taking prescription medicines and you decide you want to do this, you ought to talk to them and tell them what you're getting ready to do. But the bottom line is this: if you don't eat, will your blood sugars come down? Yes, especially if you're not eating sugars and carbs. If you don't eat, will you lose weight? Yes. So what's the problem? There is no problem with fasting. It's just how long can you do it before you have to eat. And then in that window of feasting, like we talked about from the rat in Charlotte's Web, you get to feast. You don't even have to count calories. You just have to stay away from carbohydrates. So prediabetes, metabolic syndrome, insulin resistance, and type 2 diabetes are all reversible immediately. All without cost, no drugs, no surgery, all natural, time-tested healing method. All we need to do is lead our bodies down a healing pathway and have the courage to apply what we just talked about in this class. Type 2 diabetes is reversible. And that's how you start doing it. And you don't have to start out doing, a 5-day fast. You just get into that window. We talked about time-restricted eating windows. Eat all your food within 6 hours each day. If you can do it, eat it within 1 hour and drink water the rest of the day. You can have coffee. Just don't put cream and fake sugar in it or sugar. So fasting will reverse type 2 diabetes. So we'll keep we'll keep looking at the other things that fasting does. We dipped our toe in it on Wednesday. This is actually a little bit more lengthy and applying fasting to help with a chronic disease that has always been, at least taught to me, and all of us think that type 2 diabetes is irreversible and chronic, and it's not. Okay? So I'll see you Monday. It's supposed to be colder. Those of you in Oklahoma, it's supposed to get really cold. So I've got my little sweater on, and I'll see you Monday. Have a great weekend. See ya. Bye.